Okay, hi guys, we talking a little bit about ankle injuries today. So there's something called a high ankle sprain, or in technical terms it's called a syndesmosis sprain. And the syndesmosis is a fibrous tissue that holds the tibia and the fibula together. And it's quite important in the lower part or the distal part of the ankle. So we see these injuries occasionally. They're not as common as your normal ankle sprain. So a normal ankle sprain, if you look at the ankle, occurs when you have an everted foot. So patients will tell you that they went over on their foot. And you can see it stretches the lateral complex, and that's what tears these ligaments. And a syndesmosis injury is more here, and often the foot is fixed on a playing surface and there's some kind of turning force which then disrupts the syndesmosis. So how do we check for the syndesmosis? Well, the first thing is the history. So if the player tells you that they got tackled whilst their foot was on the floor, or that their foot was on the floor and they turned and they felt something, these are generally indicators. Also look for swelling on the medial side of the ankle, which is very uncommon in a normal ankle sprain, so you don't normally see swelling here, and that can also be deltoid ligament damage. A patient will typically be very tender, not on the tip of the malleolus where we see fracture points, but slightly higher up. And they are often tender in the joint line of the talocrural joint. So those are the history items that will make us suspicious. How we then do the test: we seat the patient comfortably. You can see they're nice and relaxed. You've got your distal hand holding the calcaneus with the foot up on your forearm, which gives you excellent control, and you can move the patient and get them into neutral. The other hand firmly grasps the tibia and the fibula, and with the bottom hand you externally rotate. And I can tell you that this patient's got a good firm infield. You watch for pain, and you also try and gauge the amount of motion. You then compare to the other side, and if the patient does then have a high index of suspicion, you would refer to a surgeon, and an MRI scan would be the scan of choice. And depending on the results of that, there are several treatment options.